Hello, amigos. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're gonna talk about rib fracture, chest X-ray, and CAT scan findings. Lesson 48. Let's go. With what evidence do we, the radiologist, say the fracture? That is simple. Cortex, bone cortex discontinuity. If we find the discontinuity of the cortex of the bone, that is fracture. Please look at the left frontal radiograph. In the yellow round, we see discontinuity of frontal arc of two ribs. That is fracture, rib fracture, and we can confirm it on the actual CT image on the right side. Outer cortex and inner cortex, both cortex are discontinuous. That is fracture. Wikipedia of English version defines the rib fracture, the crack or break in a rib bone. That is rib fracture. That rib fracture usually results in chest pain. Sometimes bruising may occur. If two more points of a single rib is broken, that becomes flail, movable chest. That becomes pathologic movement at inspiration and expiration. And sometimes the rib fracture is combined with complications such as pneumothorax, lung contusion, or pneumonia. Rib fracture may occur from direct blow or pathologic fracture, or even cough can cause the fracture. Types of the rib fracture. The types are not so important in rib fracture compared with other fracture of axial skeleton, spine, or pelvic bone. There are several types, such as undisplaced rib fracture and displaced rib fracture, complete or incomplete fracture. Sometimes flail chest may occur. Two more points are broken in a single rib. That may cause paradoxical motion on respiration. And single rib fracture versus multiple rib fracture. In healing stage of rib fracture, we can see periosteal reaction and callus formation. What's the problem with rib fracture? There is usually no problem with rib fracture. They usually heals in less than 2 months. That is the most important point. Usually cause no problem. Just painful, especially in breathing. Problem occurs with other organ injury, severe injury such as lung, heart, aorta, diaphragm, liver, spleen injury. Let's move to the real images of rib fracture, acute fracture, and old fracture. On your left side, 3 ribs on a linear pattern. They show complete discontinuity of cortex line with some displacement. They are showing us acute triple rib fracture. On your right side, 1 year later, we see the deformity of the fracture line, but the cortex is continuous. That means the fractures are healed, now healed. That is old fracture. No problem now. These are usual images called rib series, composed of 3 images: anterior posterior, right anterior oblique, and left anterior oblique images. Why do we need these 3 images? Because rib fracture are 3-dimensional data. that can be sometimes only seen only single view, not in all three images. If the fracture is big enough to be identified with enough displacement, that can be seen in any of these three images. But if the displacement is not so remarkable, it can only be identified in single image. And one more, the rotation view is better in less rotation than much rotation. Little rotation is good enough to see the enough amount of rib areas. Sir, you subscribed and said good to me. Thank you very much. Be happy. Old man, incomplete fracture with osteoporosis. Rib series showed nothing about the evidence of a fracture in this case. But how about the axial CT of a bone setting image? Yes, we see deformity, discontinuity of inner side of a rib. That is incomplete fracture. Outer cortex is preserved. Let's enjoy the left frontal radiograph. Old man, multiple, linear pattern over 3 ribs. Healed, deformed. Cortex is preserved, although deformed. We can confirm it on the axial CT. Thickened, continuous cortex of rib, telling us it is healed. Old fracture. It is not easy to identify any abnormality, any evidence of fracture, or even the callus formation on this radiograph. Looking good, looking normal, but on your right side, axial CT shows us callus formation of healing process. Gradually, callus formation. First image shows nothing about the fracture at the insulting time. Second image shows a sclerotic feature overlapped with a rib shadow. It can be a rib fracture or can be pseudonodule or true nodule. The right axial CT bone setting image shows healed fracture, healed old deformed fracture, rib fracture. How about these images? AP image shows no evidence of a fracture, and left anterior oblique view also shows nothing about refracture, only the central image, right anterior oblique image. The two arrows indicate the discontinuity of a single rib fracture. That's why do we need 3 images and rib series, not a single view of a rib, but we needed 3 images of a rib series to identify correctly the rib fracture. These 2 axial CT images are showing us on your left side, 3rd rib, incomplete fracture. 4th rib on the right side, complete fracture. These images are from the same one of the previous slide. Rib series only showed 4th rib of complete fracture in the right anterior oblique view. That view even did not show us the 3rd rib incomplete fracture. The left frontal radiograph makes us the suspicion of a lung nodule or lung pseudonodule. The left side axial CT shows us the callus formation of early stage, and on the right side, the callus formation is more progressed and beautifully progressed to healing stage. Incomplete fracture. Maybe we can call it buccal fracture, just like the buccal fracture of axial skeleton. On the frontal radiograph, we don't see anything about the fracture, but the central image is 2.5 millimeter thickness axial CT. We see the buckling of outer cortex, and right side axial CT is 1 millimeter thickness thin section CT. We also see the buckling of outside outer cortex of the rib. Incomplete fracture. Pathologic fracture usually means cancer metastasis with a fracture. This is from breast cancer. We see multiple areas of rib fracture, discontinuity of cortex with bulging, and osteolytic and osteoblastic portion in the fractured rib. That is pathologic fracture. On your right side, axial CT shows us multiple discontinuity with bulging of the central portion of the rib, suggesting tumor infiltration. That is pathologic fracture. We see another example of a pathologic fracture of rib from hepatic carcinoma. On your left side, the frontal radiograph shows us discontinuity of the cortex of the rib and osteolytic change with bulging of the rib. On the medial side, axial CT shows us exactly same as what we have seen on the frontal radiograph. Discontinuity, multiple discontinuity of cortex with central myelogenic tumor infiltration with soft tissue tumor bulging inside of the rib. That is pathologic fracture. This handsome guy, the Marlboro Man, is telling us, come to where the flavor is. Come to Marlboro Country. Do you know where the Marlboro Country is? Where have all the Marlboro men gone? Regrettably, most of them are gone due to lung cancer and COPD because of smoking the Marlboro cigarettes. Sir, you stopped smoking? What a wonderful job you did this year. Congratulations. Thank you for watching. See you soon.